got a very easy job today. Instead of going to work at the hospital, I'm just going to watch someone going to work at the hospital. Today we're going to be reacting to Violin MD and seeing what life is like as a doctor in Canada. Hey guys, welcome back to my channel, and today we are doing something a little different. We are going to be watching Violin MD. She's a vlogger and a doctor in Canada, and she makes amazing videos, and I thought we could sit down, watch one of her videos together, and I will react to it. We'll see what life is like as a doctor in Canada versus my experience in the UK. If you're new to my channel, then welcome. My name's Sarah. I'm a doctor in the UK, and I make videos about my life as a doctor and also what I get up to in my free time. So if you enjoy this video, hit the like button, subscribe if you'd like to see more of my videos. I've got loads of playlists of vlogs and things that I get up to at work. Right, okay, so let's start this video.
Morning guys, I'm Siobhan, a second-year medical resident. It's a gorgeous snowy morning and I wish I could spend it outside. But today I am going into work to do a 24-hour call shift. So here we go.
Oh, 24 hours on call, wow. We don't do those as junior doctors in the UK anymore. It used to be the case that we would, but since I've been working as a doctor, it's no longer the case. We are protected by the new junior doctor's contract, and the longest hours we can work, I think, in one go is 13.5 hours. So we are quite protected in terms of our hours versus in Canada and the States. And having said that, I know that registrars and consultants in the UK can still work long shifts like this, these 24 hours ones. Doesn't sound fun.
One is meeting up with the team who was here overnight and finding out what issues there were, hearing about the new patients who were admitted to the team. Then I'm heading down to the emergency department and I'm responsible for admitting all the patients to the internal medicine team during the day.
Okay, so she sounds like she's doing a medical on-call, so it sounds very similar to the start of my shift, where you go and you meet the team that you're taking handover from, you find out about the patients, you basically normally sit in a meeting room, go through a list of the patients and find out what they came in with, what their issues are, and hear if there's anyone that needs any jobs doing or anything, any investigations that need chasing or anything you're particularly worried about. So yeah, that sounds very similar.
Hey, the team. Morning guys, how's it going? Good. Okay, there's a lot of scrubs. This tells me there's a lot of people on call. Yeah. You guys are all...
She's definitely braver than I am as a doctor and a YouTuber. She's filming all of her colleagues and they all seem very up for being filmed. They're like smiling at her, talking to the camera. I am a bit more shy about vlogging at work and I tend to just kind of talk to the camera, but when I've asked any of my colleagues if they'll be filmed, I know I did a video in my first year as a doctor where I filmed some of my colleagues, but I don't generally film them when I'm vlogging, but maybe I should. Would that be useful? Would you like to see my colleagues at work?
You guys are all on call, eh?
Yeah, right. The whole Friday, Sunday.
The whole team.
There's a lot of coffee on that table. Definitely need doing 24 hours on call.
Okay, so why don't we start with some of the night issues? You can tell us what happened with the team. So you can see some of the signs from last night. The old pizza boxes, looks like someone was doing some teaching on the board over there. But overall, it looks like it wasn't too busy of a night. I think that's because there was a big snowstorm last night and patients probably didn't want to come in unless it was really urgent.
I love that there's empty pizza boxes around in their staff room. That's very similar to what we have here in the UK. It's when you're working long shifts, you often just don't get time to eat you know, nutritious meals, and sometimes takeaway pizza is what it has to be. So yeah, that's very similar.
The question is, does that mean today is going to be super busy? So let's see what happens. I don't know, I'm just going to check out the board in the Emerge and see how many are probably coming our way for admission.
I feel like working yourself up for a 24-hour shift must be quite a mind struggle. I know when I was working on calls where I would do 13.5-hour shifts, that felt like a real hurdle, and when you had a few in a row, it was just, yeah, exhausting to think about having to do that. So I wonder what she feels like before she goes in for one of these shifts. Do any of you already watch Violin MD? I just get the feeling that Siobhan is a really lovely person and that I would be friends with her in real life. Oh, her beeper's going off.
Hi, this is Siobhan, the SMR. Yep. Yeah, do you mind just getting another repeat ECG? And I'll be in to see them in just a little bit. Perfect. Great, thanks very much.
So that seems quite similar to what we do when we're on call. We have these pages that we use. You might have seen them in my previous vlogs, and you'll get a phone number that flashes up on the screen. You get this horrible beeping sound, which still gives me nightmares. And then you phone the phone number, and it's, you know, one of the nurses or another doctor in another ward bleeping you. And generally it's to tell you that a patient's deteriorating or to ask you to do a job. So it looks like she's been bleeped about a sick patient by one of the nurses, and she's asked them to do well, they call it EKG, but we call it ECG, tracing of the heart. So sounds like they may have had some chest pain or something, and she is going to get the nurses to do a few bits before she gets there, which means that when she gets there she can do her work, which is good.
So before going to see a patient, what I typically do, as long as they're stable, meaning their vitals are within normal range and I'm not concerned that things are progressing very quickly, in which case I go and see them right away, I'll often just take a look at previous notes, get a sense of their past medical history and write it down, look at their home medications, and look at the lab work that's been done by the emergency physicians. That already frames in my mind some concerns so that when I go and see the patient, I can tailor my history and my physical exam to these issues.
Okay, so here she's talking about before she goes to see a patient, if she's been called, she has a look at their notes and some of their previous blood results, their past medical history, so that she can get an idea of the patient as long as they're stable before she goes to see them. And that is so similar to here, and I'm glad that she said that, because as a junior doctor, it can be really tempting when you get a call to just panic and go and see the patient straight away, and then you have to go back and read through the notes and you don't appear confident because you don't know much about the patient themselves. If you take the time to step back and read through everything and build up a bigger picture of the patient, generally your job is easier, and you can treat the patient more effectively, and you know when to ask for help. But as she said, it's important to make sure the patient's stable before you do that.
Who's now having some electrolyte abnormalities. So they're hoping we can review the electrolytes. They'll take care of the mental health side, we'll take care of more of the physical medicine, and together hopefully we'll make the patient feel a lot better. And it's so nice because I actually know this resident from medical school. It's nice when you know people around the hospital.
Okay, that bit's really lovely. She gets a bleep from one of the psychiatry residents who happens to be one of her friends from medical school. That's really lovely, and it is something that does happen in the hospital. You find that the medical world is a small place. You rotate around a number of different hospitals, and people that you've studied with or worked with before end up crossing paths again in the future, which is quite nice. Yeah, it's nice to come across people that you know when you're on a particularly stressful or busy shift. She's having a salad for her lunch, very nutritious. I don't know if that would keep me full for the whole day. And the jobs that she's having to do in her on-call shift seem quite similar to the kind of jobs I was having to do as a UK doctor doing medical on-calls. She's had to replace an NG tube, they call it a feeding tube, nasogastric tube that's come out. She's had to go and review a sick patient that was very short of breath. Very similar sort of problems to this kind of thing I would expect to be doing on a medical on-call.
I think this patient aspirated, meaning they sort of inhaled either some food or maybe it was just saliva, and it went down the wrong way, and that made it a lot more difficult to breathe. And you can see this on the x-ray. So this patient's going to be going to a more monitored setting, meaning they can monitor their heart rate, their oxygen levels, and there's just more nursing to patient ratio because this patient's sicker. So they're being transferred there now, and I'll go in.
She's doing a lot of walking around the hospital, and I feel like that's also very similar to the kind of thing we would be doing on call. You're going from the emergency department back to your base ward and then reviewing patients in other departments, going to the admissions unit. It's very similar.
Okay, just got 2 more consults, and now that it's 4:30, I think I'll just recruit some more help from the other residents that are here today.
Hey, Siobhan.
Oh, hey! Oh my gosh, I can't believe it's 5 p.m. already.
Okay, so it looks like from 5 p.m. she is joined by a second medical resident, so she's got another doctor with her for her on-call. That is a relief. When you get your second person coming to join you when you're on call, it's always really nice. I remember when I was in my first year at Lincoln, on some of our on-calls you'd be on your own and you might be covering basically all of the medical wards of the hospital or all of the surgical wards of the hospital, and it was very daunting. And then those shifts where you had an extra person joining you, you just felt like you had that extra safety net, and they'll probably be the same level as you, but it means that you've got someone else to run things by or someone else who can do jobs as well. So yeah, that's a relief, and she looks like she's quite happy to have that other person joining her.
Wait, 9 p.m? Totally unheard of. So maybe I'll get a little bit of sleep and then I'll go down around 4 a.m. to take over and do some consults at that point.
Okay, so it's 9 o'clock there, and she's saying that she's going to go and try and get a bit of sleep, so they must have an on-call room where they can go and relax overnight, and that she's going to try and get up at 4 a.m. to go and do some more consults. See, this is the difference between medical shifts or on-calls in the UK versus in America or Canada, that you would have someone doing the day and someone doing the night, and on the night shift you're expected to stay awake and be working the whole night.
A little bit early, that's no problem at all, but this is so nice. Get some sleep. It's a good room, but it's freezing, man.
That's nice, they get a proper room to sleep in.
All right, it's 4 o'clock. Apparently we just got 3 new consults, and they look on the sicker side in terms of breathing, and so I'm just gonna head down to the emerge now and help out doing some of these consults. Man, it is so cold in here.
I think I find it really disorientating to wake up in the middle of the night in the hospital after having a few hours sleep and then have to go straight to work. That would be very difficult, and I feel for these guys having to do that. I like the fact that when I'm at work I'm awake the whole time. I don't have to worry about, is my hair messy? You go in, you stay awake, you do the job, then you go home and sleep.
Just finished my last note, 5 minutes to spare. Tim Hortons is now...
She looks so awake. How does she look so awake? She looks like she's just starting her shift. And what do they do? Do they have a shower at work? Do they get to... where do you leave all your stuff? Yeah, I can't imagine doing a 24-hour shift.
It's just about 10 a.m. leaving the hospital now. Wow, so we admitted 20 consults overall overnight, so I don't know, like a busy, steady sort of night, not really all that unusual, so we didn't really get slammed after the storm.
So she's saying that they admitted 20 people overnight, and that seems like a fair amount of people. I'm guessing that she didn't clerk all of those patients herself, and that there were other residents doing that as well, because 20 people overnight would be a lot to clerk on your own. Well, that was a great video. I feel like there's a lot of similarities between working as a doctor in Canada, like Violin MD, Siobhan, and working as a doctor in the UK. I think that the job itself sounds very similar, the main difference being the hours and the fact that when they're on call they actually sleep and stay overnight. Really interesting to watch that video, and it's really nice to feel like there's someone doing something so similar to you but over the other side of the world. So maybe I'll do some more reaction videos like this, and maybe I could do some in different countries. If you guys are interested in seeing more videos like this, then drop me your favourite medical YouTuber in the comments below, and maybe I'll react to a vlog that they've done. If you've enjoyed this video, then give it a thumbs up and hit the subscribe button if you'd like to see more of my content, and I will catch you in my next video. Bye guys!